Welcome to our discussion of the lower limb. For learning outcomes, we have a pretty straightforward, simple idea here. Simply identify the lower limb bones and their important markings. Lower limb's designed to carry the weight of the entire erect body. It's subject to exceptional forces when you're jumping and running, and there are really three segments to this lower limb. The upper part is called the thigh. Your leg proper actually starts below your knee and it is the knee to ankle area. Below that we have the foot, of course, and we'll take a look at the bones of each of the three segments kind of in their own turn. Bones of the thigh really is bone of the thigh. There's one and one only on each side. The femur, and it is the largest, strongest bone of the body. It makes up about 1/4 of your entire height, and it articulates proximally with the acetabulum of the hip. That's that vinegar cup we talked about in our last video. It articulates distally with the tibia and the patella. The patella, of course, would be your kneecap. The patella is a sesamoid bone that's embedded in the quadriceps tendon. We've mentioned the word sesamoid briefly in a previous video. The word comes from the name for sesame seeds, which it's shaped like, and the definition of a sesamoid bone is any bone that is embedded in a tendon. Everybody has two, your kneecaps of course, and then they randomly occur at some other joints. One of the more common joints to find other sesamoids in is the joint of the great toe with the metatarsal. Not uncommon to find a sesamoid bone at that joint. In this image we see the two bones we've just spoken of. We see the femur and the patella. We'll get to the patella in a moment. I want to focus on the femur first. We see the anterior view on the left, the posterior view on the right. And I'm going to start at the top and work my way down. Up at the very top we have one of the more recognizable features of the femur, this very large, very rounded head. It's about 3/4 of an entire sphere. It's supported on a neck that you can actually get your fingers around. Together, these make the spot where the femur fits into the acetabulum of the pelvic girdle. Before I leave the upper part of the femur, though, I want to discuss the fovea capitis. It's a little depression that you see on the medial aspect of the head. It is, if you're holding a femur in your hands and you're not aware of this, it looks like somebody has dropped and chipped this bone. In fact, that's not the case. The fovea capitis is the site for attachment for a ligamentum known as the ligamentum teres that attaches on the inside of the acetabulum and helps to hold the head of the femur inside the hip. Coming down just a little bit and off to the side, a little medial, we get to a very large protrusion, the greater trochanter. Below that, a smaller protrusion, the lesser trochanter. You can see in the posterior but not the anterior view that those two are connected by an intertrochanteric crest. Below that, we see an intertrochanteric line in the anterior view and a gluteal tuberosity in the posterior view. The gluteal tuberosity, as you might imagine, is the attachment site for the gluteal muscles. We'll talk about those, of course, in our next session, the muscles. Coming down on the posterior view, there is a very prominent line that shows up in most people, the linea aspera. It's a good example of the reality that we mentioned a while back, that as muscles pull on bones, bones grow. And that certainly is the case here. There's a lot of very prominent muscles in the leg, and they tend in many people to make this very prominent ridge, the linea aspera. You can also see a little bit lower some similar lines farther down on the femur, the medial and lateral supracondylar lines. Coming down to the very bottom, let's look at the epiphysis, and I want to talk about several structures we see here. From both the anterior and the posterior view, there are enlargements that stick off to either side that are epicondyles. There's a lateral epicondyle and a medial epicondyle that flare out and make the distal end of this femur very much kind of a wide bell shape. From the posterior view, we have a look at two polished articular facets known as the lateral and medial condyles. These are the femur's contribution to the knee joint. You can also see in the anterior view the patellar surface where the patella sets. And that's a good clue to take us over to the extreme left side of the page and look at the patella. The kneecap is visible in both anterior and posterior view, anterior on the top, and you can see from this upper picture why the patella is often described as being sesame seed shaped. And this is the origin of that name, sesamoid bone. There are two facets on the posterior aspect of the patella, the facet for the medial condyle of the femur and the facet for the lateral condyle of the femur. On to the next page, bones of the leg. Of course, in this particular case, the leg would be the area between your knee and your ankle. So let's take a look at the two bones we would find here. There is, of course, the tibia. The tibia happens to be the second largest bone in the body. It is the medial bone of the leg. So if you're standing looking down at your own feet in a pair of shorts, the inside of the lower part of your leg, or your leg proper, is the tibia. The outside, on the little toe side, would be the other bone we'll get to in just a moment, but this is the inside by the big toe. This receives the entire weight of the body from the femur and is the only weight-carrying bone of the leg. It transmits that weight to the foot. The other bone, the fibula, is a non-weight-bearing bone. It actually has no articulation with the femur whatsoever, but it does anchor several muscles that originate from the fibula. It articulates proximally and distally with the tibia. There is no femur articulation for the fibula. Tibia and the fibula do connect to each other in much the same way that we saw in the forearm by an interosseous membrane. And as we turn the page, you can see how these two bones fit together. Again, between the two of them, there's an interosseous membrane. The much skinnier fibula is the bone that we see on the left side of this page. It has a head on the upper end. There is a lateral malleolus on the bottom end of the fibula. The middle of that, of course, is the diaphysis, and the fibula joins the tibia at the superior tibiofibular joint. It joins the lower end at the inferior tibulofibular joint. Now I'm going to put a word on the screen that I want to be certain you never use. It's a word that does not exist. The two bones that are on the screen are the tibia and the fibula. I never want to see an answer from you that is this particular word. I'm not even going to say it out loud. It's just wrong and it doesn't belong here. Now, looking at the tibia, it's sort of a T-shaped bone on the top, and that's one way to keep that straight. The tibia at the top has a couple of little protrusions that, as a pair, are the intercondylar eminence. The upper part of the tibia flares out like a T, and what we don't see in this image, but we will see in another image, is that it has two little cup-like depressions on its top. There is the articular surface of the lateral condyle and articular surface of the medial condyle, but those two wings, if you will, on the upper side are the condyles, the medial and lateral. And in another image we'll see the back side, and you can actually see that there are little depressions there. On the front, in fact, grab your own knee, pause for just a minute. I'll hold the video while you reach down and grab your own knees on both sides. Move your kneecap around a little bit and move your fingers a little bit lower, and you can feel a bump, a very prominent bump, probably for most of you, on the front upper part of your tibia. That's the tibial tuberosity. Coming on down to the very bottom, you can see that the lower end of the tibia is a little bit L-shaped. That little extension that sticks off on the side is the medial malleolus. That's that bump of bone on the inside part of your ankle. Next page, we got a posterior view over here. We can see these same two bones from the back side, and now you can see really nicely what I was describing there on the top side. Those flared out wings on the upper edge, again, they're still the condyles, and you can see nicely the articular surfaces on both the medial and lateral condyles. They are indeed sort of two cup-like depressions, and you can see better from this point why that intercondylar eminence almost looks like it's two things sticking up. It's actually the lip of those two little bowl-like areas. Again, nothing really particularly new on the bottom. You can see the sort of toothpick-like nature of the fibula, and you can see very well the medial and lateral malleolus. Now, in this view, I want you to focus, and I'm going to highlight the distal ends of both of these bones. those malleolus, both medial and lateral, effectively form a little cup, if you will, and they set down on the ankle bones, and they keep the leg from slipping off the top of the ankle. We have a close-up view on the next page that shows the proximal epiphysis of the tibia, and you can see some of the features we've been discussing in a little bit more detail. I'm not going to go into these in a great amount of detail here, but you can certainly see items we've discussed. Now, there's a little bit of a graphic image on the next page. Don't cringe. Somebody has fractured a fibula in what is commonly called a Pott's fracture. And you can see the broken ends of that fibula there. It would be quite painful, but it fortunately is not the main weight-bearing bone of the body. Yes, it still would have to have a cast. As we discuss the foot, you'll see that there are really three separate groups of bones that make up the foot. There's the tarsus, the metatarsus, and the phalanges. Tarsus really is 7 separate bones that are, as a group, known as the tarsal bones. They make up the back half of the foot. They are sort of technically what might be described by a casual observer of the foot to be ankle bones, but really the bone that a common person would refer to as the ankle is only a couple of these and the lower ends of both bones of the leg. Most of the weight, in fact all of the weight of the body, is primarily carried by 2 of these tarsal bones, the talus and the calcaneus. Other tarsal bones include cuboid, navicular, and then 3 cuneiforms, the medial, intermediate, and lateral. And you'll see all of these in images that are coming up here in just a moment. The metatarsals are 5 bones numbered 1 through 5, starting with the great toe and moving over to the little toe. Another name for the great toe or big toe is the hallux. The enlarged head of the metatarsus forms the ball of the foot. Phalanges, hey, this is the same name we use for your fingers, but phalanges down here are your toes. They're 14 toe bones, if you will. The first toe, the great toe, the hallux, only has 2 bones. There's a proximal and a distal phalanx, no middle phalanx in the great toe. And the other toes all have 3 bones, distal, middle, and proximal. Oddly enough, the little toe has more bones than the big toe. Strange but true. In this image, we have a top-down view or superior view of the foot, and we're going to be discussing 3 groups of bones. The first we'll take a look at are these 7 bones here, the tarsal bones that make up the tarsus of the foot. I'm going to start at the bottom of the page and work forward. We have the calcaneus, the largest of these ankle bones. This is the one you probably call your heel, and it is together with the next bone, one of the main weight-bearing bones of the foot. Coming over to the medial and forward just a little bit, we get to the talus. The talus articulates directly with the tibia, and it has a polished surface on top of it by which it does that. That polished surface is the trochlea. So it is the foot's contribution to the ankle joint. Coming a little bit forward from the talus, we get to the navicular bone. It is just anterior to the talus. Coming over to the lateral side, we get to the cuboid, and it is just behind the little toe and the next toe over. Coming over behind the great toe, we get to the first of 3 bones that are called cuneiforms. There's the medial cuneiform right here behind the great toe. Now be careful with the name medial. It does not mean that it's in the middle of these 3. What it means, it is the most medial of the 3, which means it's over on the inside of the foot. Next bone would be the intermediate cuneiform. It is the middle of those 3 cuneiform bones. And then coming over one more, we get to the lateral cuneiform. Again, be careful with that name. It does not mean it is on the lateral aspect of the foot. It means it's the most lateral of the 3 cuneiforms. That finishes the tarsals. Let's move forward to these 5 bones. Notice they're numbered 1 through 5 in Roman numerals. The numbering system starts at the great toe, ends at the little toe, so metatarsal number 1 is the metatarsal of the great toe. Coming out to the last group of bones, we have the phalanges. Most of these actually have 3 separate bones, a proximal, medial, and distal phalanx. That's not true for the great toe. There is no middle, so we only have a proximal and a distal phalanx on the great toe. On to the medial view. In this medial view, we really don't see anything particularly new. I'm not going to discuss individual labels. You just have new views of bones we've seen before. So get familiar with this view. Same will be true for this picture, which is the lateral view. Nothing especially new here, just a new view of the foot. Let's discuss the arches of the foot. The arches of the foot, and there are 3 of them for each foot, are maintained by interlocking bones, ligaments, and tendons, and they help the foot to bear weight. Those 3 arches are the lateral arch over on the little toe side, the medial arch on the big toe side, usually a taller arch than the lateral, and the transverse arch, which goes across the top of your foot like your shoestrings or the tongue of your shoe. Looking at this image, you can see those 3 arches. We're looking at the lateral aspect, so the little toe is closest to us. That green line would represent the lateral longitudinal arch. The red line kind of coming across, and that's not the best way to draw that, I don't think really personally, is the supposed to represent the transverse arch. It does go kind of up and down on the underside of your foot. And the medial longitudinal arch would be on the big toe side. It's why they've got it in a dashed line here. It's that nice tall arch that goes from your heel up toward your big toe. On the next image, we see an x-ray of the medial aspect of the right foot. So this is an x-ray of somebody standing on tiptoe. Kind of an unusual thing to x-ray, but that's exactly what we've got here. What we have next is the slide you have been indeed waiting for, concept checks. What lower limb bone is the second largest in the body? I actually told you that, so hopefully you got that. Where is the medial malleolus located? Good point. Make sure you know what that name means. Which of the following sites is not a site of muscle attachment? The greater trochanter, the lesser trochanter, the gluteal tuberosity, or the lateral condyle? Besides supporting our weight, what is a major function of the arches of the foot? Lastly, what are the 2 largest tarsal bones in each foot, and which one forms the heel? That will do it for this video. We're almost done with this chapter. We got one more short video and we'll be done. Thank you. I'll see you in the next and last video for the chapter. Thank you, Sawyer.